Welcome back to Daily Flash. There's been a lot of news recently about taking aspirin for your heart health. We're breaking down the guidelines and sorting out the confusion over what a doctor-directed aspirin can do for you and who should take one.
Thanks for having me today. There's been confusion related to appropriate aspirin use, and so this is an important opportunity to talk about aspirin as a strategy for heart disease and stroke prevention. Aspirin use remains an appropriate strategy for heart disease and stroke prevention among those living with prior heart disease, those that have had a heart attack, a stroke, a bypass surgery, or a stent. In this population, aspirin can reduce the chances of a second cardiovascular event. In fact, we know over the next 5 years, this higher risk population has a 1 in 5 chance of a second heart attack, a 1 in 4 chance of a second blood clot related or ischemic stroke, and aspirin can reduce the chances of that second heart attack by about 30% and a second stroke by about 20%. Aspirin's a medication. Its mechanism of action is to reduce the stickiness of cells in our bloodstream called platelets. These platelets, if they aggregate or clump, can cause an unwanted blood clot, and so aspirin use is helpful to reduce the likelihood of a potentially harmful blood clot. I think the most important advice I could give to the viewers today is discuss appropriate aspirin use with your doctor or clinical team. Don't stop aspirin if you're taking it right now. Have this discussion about the potential benefits, but also risks and side effects of aspirin. If you want to learn more about aspirin, but also the Million Hearts Initiative, I am a practicing cardiologist. I serve as the executive director of the Million Hearts Initiative. This is a national initiative focused on the possibility that we can prevent 1 million heart attacks, strokes, and cardiovascular events in our nation through the implementation of proven and effective strategies like appropriate aspirin use. So to learn more about Million Hearts and appropriate aspirin use, go to millionhearts.hhs.gov.